All right. Hey, good afternoon, everybody. My name is Dre Johnson, ad personality for 92Q, of course, co-host, local producer for the Morning Hustle, also 2 to 6 on Saturdays. And you can also catch me on TV on Fridays or WBAL TV, 11 News for the Breakfast Bite with Jason and Mindy. And we're here with the Maryland Health Connection today, which is the state's insurance marketplace. And we're bringing you barbershop talk today, man. This is something interesting. A lot of things is talked about in the barbershop. It's a little different nowadays because of the pandemic. And one big topic this year is definitely our health. And of course, I'm excited to welcome Damian Davis from Healthcare Access, Maryland. And Damian is here to represent the Maryland Health Connection. What's up, Damian?
How are you doing? How are you doing? I'm blessed to be here.
No doubt. And of course, also want to welcome Andrew Suggs.
What's going on, everyone? Andrew Suggs, CEO and co-founder of Live Chair Health.
No pen to Suggs, right?
In passing, if I need to get some type of leverage somewhere, I'll mention it. But formally and officially, I'm not sure. But if he's watching this, I would love to connect. We can find out together.
All right. Of course, we got Shanile Shakoor, represent Nile Style Barbershop here in Baltimore. Where's the location, buddy?
6622 Harford Road.
Okay.
Right here in Baltimore, Northeast Baltimore.
And Shanile actually connects people in the barbershop with a lot of things, including healthcare. And that's what we're going to talk about today. Healthcare, especially during this global pandemic. And, to start off, how's everybody doing?
Great.
Great. Everybody.
Yeah. We are
man.
Yep. Blessed. That's my key word for this year of 2020 is blessed.
All right. So each of you, what are some things you've been doing? One thing you've been doing, to stay healthy during this pandemic. Damian.
Staying in the house, taking care of family, always wearing a mask. And just always reassuring and just make sure you pass on the information. And when you see somebody, just pass on that good information. Wear your mask. It's okay to stay home if you can stay home.
Yeah.
Some of us can't stay home.
Yeah.
But to be safe until this whole pandemic, dies down. But we figure out a remedy. Stay at home if you can.
No doubt. What about you, Andrew?
Yeah, so one of the things I do to stay healthy, I drink a ton of water, which is represented right here. And I have to flavor it up, right? Add in some blueberries, some strawberries, some lemons, some mint, right? It'll really acts like a detoxer, and it's just really refreshing overall. So 30 minutes of cardio a day. I think one of the misconceptions, specifically in our community, is that you have to go to the gym for 2 hours and be healthy. Like that's how you be healthy and get stronger and maintain good cardiovascular, et cetera, et cetera. But that's not true, right? If you get 25 minutes, right? That's my charge to all my brothers and sisters listening to this call. 25 to 30 minutes of brisk walking or some type of activity a day, it will keep you healthy. I'll just say that, right? As far as like the COVID and how I'm dealing with it, to Damian's point, masking up, I probably washed my hands more than I have the last 32 years of my life. So, outside of that, I'm just following the guidelines, and we're trying to do everything possible to protect the shops that we partner with, like Nile Style and our brand ambassador, Mr. Shakoor.
All right. Mr. Shakoor,
Yeah.
about you? What have you been doing? One thing you've been doing to stay healthy.
Oh man, the one thing that I've been doing, which I've continued to do, was get up at sunrise and take a walk. Take maybe like a mile walk, and before the air is compromised with commuters and the to and fro people, it gives me time to just kind of just relax, kind of reflect, get into myself, and kind of organize my day and get my thoughts right. So that's what I do. Yeah. A mile a day, get up in the morning, every morning.
Yeah. I think for me, one of the things I've been doing to stay healthy is staying in the house. I've turned into a homebody during this pandemic, and sometimes it affects your psyche. But you know, I think with prayer and meditation, it's one of the things I've been doing to stay, you know, stay healthy. It's been you know, taking me through. Interesting enough, I had a doctor's appointment yesterday, and you know, last week I was gonna go in when my appointment was scheduled, but I decided the day before yesterday that I'm not going to be able to go into that office. So I actually called the doctor, and they set up you know, a virtual appointment, which was different among a lot of things that is actually going on during this pandemic. And so I know that the Maryland Health Connection has linked up with Live Chair. Andrew, tell us about Live Chair. What is it about?
Yeah, so Live Chair Health is a Black founded and owned company. Our aim is to address health disparities found amongst people of color, starting with African-American men and women. And so what we do is we partner with hair salons and barbershops to screen clients for high blood pressure pre-COVID, diabetes, and other chronic conditions, and then get those same clients to complete a health risk assessment, which gives us insights on how we can better care for our community. And then we connect those members or those clients to primary care providers to manage their health. Because one of the biggest things in our community is that we don't see our primary care physician once a year, right? And if you don't have that relationship, you don't have a baseline of where you are from a health perspective, and then a plan to get better if you don't have that relationship. So we want to entrench the relationship just like barbers have with their clients, just like stylists have with their clients. So that's what we're doing, leveraging the unique social trust of barbershop and hair salons. And yeah, that's what we're about, and that's what we're looking to do.
All right, and Damian, how you doing? Damian's back. Damian is from the Maryland Health Connection. Let us know about the Maryland Health Connection and what you actually do over there.
Well, Maryland Health Connection is states about it as maybe a one-stop shop where you can find a health plan that fits your family's needs and budget. And right now, it's the exact time to sign up for health insurance for 2021. Many people don't know that about health insurance, or that they're actually eligible to receive health insurance. So that's why we promote from November the 1st to December the 15th. It's very important to sign up for health insurance, whether you're employed or not employed. We have to push that. Without that, we can accumulate some very large bills, which are very, very hard to pay, especially if you're unemployed or you just need to pay your everyday living costs. So November the 1st through December the 15th, we're pushing that. We've been pushing it for years now.
All right, so Damian, how is this different from Medicaid or Medicare?
So
or even your job's insurance. What's the difference in this?
Well, with Maryland Health Connection, it kind of embraces everything. You can actually apply for Medicaid through Maryland Health Connection, and you can apply for a qualified health plan with financial assistance. And if your job does offer you health insurance, technically, as an employee, you're supposed to take that insurance with your employer. But if you have a household or family members, all of your family members do not have to actually go on your job's insurance. They can actually still apply through Maryland Health Connection, which we will analyze your family's household size, income, demographics, and then shop for them for a plan that suits their needs, whether it be minimum or maximum. Some individuals, which bronze plans would be for an individual who doesn't go to the hospital as often, but just wants insurance for that just in case. And that's what insurance is. It's a just in case need, something for you to have just in case something happens. Then you have silver plans, which are for those who get their average checkups.
What's that again?
Silver plan. That is a part of the qualified health plan.
Okay.
Those who are not financially eligible for Medicaid, but we're not saying that you can't get health insurance. We're saying that we're going to offer you financial assistance to afford health insurance.
Okay, so you guys give money towards if someone wanted to apply for this plan, you guys actually apply money to that?
Yes, so we give the financial assistance for those families whose household is above the Medicaid threshold.
Okay.
Because there is a specific criteria for those who are, I guess, eligible for Medicaid. Now, after that, you're eligible for a qualified health plan, and you can get financial assistance. And if your family's household finances are above that threshold, we're still going to offer them health insurance. It might be with or without that financial assistance. And as far as Medicare, we don't technically deal with Medicare. That is a part of the Department of Social Services and Social Security.
Okay. All right. And so this is Obamacare, basically.
Yes.
Okay. All right. Shanile, you have a chance to talk to so many people in the barbershop. What would you say gets in the people's way from taking care of their health, especially in the Black community?
Oh man, in the Black community, one thing that gets in the way is we sort of get in the way of ourselves by programming. When you look at the hood, a lot of us, we live in food deserts. There's not a lot of resources in terms of, good food to eat. So we basically go to what's there, and it becomes a condition where we condition ourselves to say, hey, this is what it is, and this is what we eat. You have young people, when you come down to healthcare, that they seem invincible. They don't see the importance of, having a plan, having healthcare, because they're so young, they're so healthy, they don't see themselves getting sick. But when you look at the older generation, and when you're talking about the barbershop, because we have so many people that come through that we talk to, these individuals, it gets to a point where they feel like they can't afford it. And the value of having healthcare, and in terms of you paying bills and not seeing the value of it, when you look at the layers of coming up and being conditioned, it's one of the things that we kind of put to the back burner.
Yeah. Okay. We're sitting here with the Maryland Health Connection. This is Barbershop Talk today. If you have any comments, make sure you post them. We're going to get them answered. Damian, real quick, he was talking about affordability for these plans. How much do these plans cost? Are they monthly? Is it 2 week where the money comes out of possibly your check? How does these plans work, and what's the cost?
Well, that all varies. Now, the monthly premiums, they are monthly, and they go directly to the healthcare provider. You're not paying Maryland Health Connection. What we're doing, we're assisting everybody by offering that financial assistance. We're here to pretty much make things affordable and to make sure that you're getting the correct plan. We just don't want you to buy any plan because it might not be useful for you. So therefore, when you contact a navigator like myself, we take your family's household size. And when people talk about households, a lot of people get confused. They're like, oh yeah, so my uncle lives with me, my grandmother lives with me, I have a niece and nephew that live with me, but it's technically not who lives under in your home. It's actually about your tax filing status.
Okay.
That is your household. Now we would take that and we would assess your income with everybody that is technically in your household. Whoever is filing is under your tax filing status, and it is computed in the system where it would take. I've seen plans from $3 a month all the way to possibly $200, $300 a month. So it all depends, and that's why we always promote going to www.Maryland Health Connection, and that's Maryland fully spelled out, healthconnection.gov, to even get an estimate. And a lot of people are scared. They don't maybe afraid of actually starting an application. That's why we have the estimate button on the website. So you don't have to apply fully. You can just do a quick estimate synopsis and say, okay, this is the amount of family members in my household. This is an estimate, a rough estimate of how much we make and what plans are available for us. and it will show you right there without putting in your personal information. Everything is located right on mentalhealthconnection.gov.
You gave me some new information. I didn't know that a household that so if you have 10 people living in your household, that doesn't matter if it isn't under your tax filing status.
It doesn't. It is not considered your household.
Really?
Yes, because there could be tons of people in your house filing single. That might just.
That's interesting, man. A lot of people don't know that.
Yes, so that's why our job is so important, to make sure that people are getting the right financial assistance and that people are completing their applications correctly.
So, Damian, what have you found to be an issue of why people don't necessarily want to take care of their health and come to you guys? What do you think one of the biggest issues is?
It's a lack. I feel like it's the lack of the simplicity of the application. People, when they go on the application and they start asking for your phone, like your personal information, they think it's going to run your credit. They think it's going to do other things, and it's not. It's simply just, breaking down your household to see what you're actually eligible for. And since we provided that face-to-face front for Maryland Health Connection, which is my job, I'm a navigator, it's become a lot easier for people to come out and feel more comfortable now. And then once we show them how to do it, many of my clients, they will just call me back the next year to make sure they did it correctly instead of coming back to me. So it's all about, as the years go on, it's becoming a little bit easier and easier and more, I guess, common to people now. Before it wasn't as common. Everybody was afraid of getting health insurance. And many people just felt like they didn't need it. I agree with Shanile. Like, I agree. People were afraid to get health insurance or just feel like it costs money, so therefore we don't need it. But you do need health insurance just like you need car insurance when you have a car.
Oh yeah, and life insurance and all of it is
everything.
Yeah. So yeah, the deadline is December 15th, correct?
December 15th is the deadline. And we press everyone to come out. Well, we're not coming out anymore. Before, pre-pandemic, you used to be able to visit us in the office. But we are working, teleworking, so you can call us between the hours of 8 and 8 and 5 o'clock. And that's Monday through Friday. And we are accessible for you through the phone. And to go over plans, update applications, and pretty much go over all the needs for your family's household.
Okay, and again, that number is 410-500-4710. Okay, we're talking about the pandemic, which is at the top of all our minds here in Maryland and around the country, around the world. COVID-19 testing and services are part of this plan. And how does it work?
Well, with the plan, you would pick your qualified health plan, which ranges from 3 different qualified health providers that we are offering this year. And for Medicaid, there are numerous amount of MCOs, which are managed care organizations, which are just another name for provider. Okay. Now you would just reach out to them, get the most, I guess, the closest testing center, and that is actually covered under your plan as well.
Okay. And Shanile, real quick, what advice for people this year as they face this pandemic and try to avoid getting sick? What advice would you give them, especially in the barbershop?
Oh man, as a barber, I would give them the same advice, sort of on the lines of the CDC. Keep your hands clean, keep the hand sanitizer on deck. Make sure you stay, away from large crowds. Keep yourself safe, wear your mask. But also, importantly, is your health mental wise. Being that we're staying in the house.
Yes.
We want to be able to, and I would advise all my people in cutting hair in a barbershop. I always ask, one of the things, if you are my client or you know me, the one thing I ask is, what are you reading right now? So I would advise people to get something to read. You can't go out, you can't go to concerts, you can't go to certain places, but get yourself something to read to keep your mind stimulated. So that mental and that the whole health, the whole mind and body is so important. So that would be my advice.
Oh yeah, mental health is really, really big in this pandemic. It's affecting. I mean, you got the pandemic and you got mental health is going hand in hand. And Damian, I want to ask you about the mental health. Does these plans cover mental health? Because mental health is just as important as our physical health.
Yes, in fact, these plans, they do cover mental health. And I'm going to piggyback off Shanile. Like, we are here in a situation where we never thought we would be. You have stay-at-home mom and dads now being the teacher, the PE teacher, cafeteria lady, janitor, all of that, because the kids are at home. And that could be very, it could be a lot on your mental. And honestly, keeping up with your job, all that into one. They do cover all types of therapists, whether they are they're doing the therapy as well, because we are making sure that everyone is safe, so they can actually do more sessions online. And also with the therapists, they come from group therapy to also single session therapy. So they cover everything that you would need. And that's why, again, we stress the importance of applying for health insurance.
I agree. We've been talking, we're here with the Maryland Health Connection. We've been talking about open enrollment, which is December 15th is the deadline for 2021. And of course, everything is available for the people who may be looking for health insurance right now. Andrew, why do you think healthcare is so important, especially this year?
Yeah. So healthcare is so important because so let me take a step back. One of the reasons why we pivoted the business away from where we originally started, which was scheduling and booking for barbers, into healthcare, is because of the decline of my father's health. So unfortunately, just speed up the story, 3.5 months ago, my father passed away from congestive heart failure at the age of 56. And so the national life expectancy gap for just the general population is 76. So his life was cut short 20 years, right? 20 years. And my father is not an anomaly, right? Like, that's common in our community. And it's because we're not engaged in our healthcare. We don't have that relationship with our PCP like we do with our barber or hairstylist. We have a lot of myths in the community as well, just like the brother Damian mentioned about health insurance, like, you're going to run my credit if I do an estimate. So there's a lot of myths in the community that we have to dispel in order for people to understand the importance, because health is literally, if you can't be healthy, like that affects your job performance, that affects your financial performance, it affects your mood, right? As we talked about some of the mental health aspects, right? A lot of it's tied together with the physical aspects, right? Like, if you're out of shape, or if you're not on a good diet, or whatever the case may be, that's going to affect your mental. And so one of the reasons why we have taken this journey to partner with barbers, or just say hair professionals, is because we believe that that's an access point for us to engage our community, right? Like, our community is dying at an alarming rate. Like, I think the gap in Maryland across the state for African-American men and women is nearly 8 years, right? And that's the average, right? Certain pockets of Baltimore specifically, that gap is like 20 years, like my father. And so why it's so important to engage in your health is because if you catch things sooner, you have a shot at living a lot longer, right? So we all know what happened with Chadwick Boseman, right? Who passed away at the age of, I think, 39 or 40 years old because, and correct me if I'm wrong, I think his condition exacerbated so much that it was kind of too late for the doctors to intervene. So one of the things we advocate for is getting screening earlier, right? So because my father passed away 20 years earlier, I'm more focused on, what I put in my body. I'm more attuned with my primary care physician, right? I treat my primary care physician like I treat my wife. Like, hey, I'm paying for the, think about it. You're paying for the insurance. Like you know, like so I ask every question and you know, if you're paying for the insurance or if maybe you qualify where you don't have to pay because of the regulations for the AHA, the Affordable Care Act or ACA, the Affordable Care Act or / Obamacare, you use the insurance, right? So engage in your health because it literally will determine how long you live. And not only how long you live, because my dad had been in and out of the hospital for probably a good 7 or 8 years before the episode that took him out. But had he been engaging, say at like 25, 30, just incrementally doing things, I think he still would be alive today. And the last point I'll say is, yeah, you might say you beat the odds, right? So you don't take care of your health, you neglect it. Your quality of life is going to be diminished because you're going to be dealing with so many chronic diseases, which is highly represented in our community. Almost in every chronic condition category, we are overrepresented. So there are simple things that members can do. And livechair.co, that's our website, where you can find one of our partnering barbershops, livechair.co, like Nile down in the Northeast, and some other shops, in addition to going to our website and signing up for different resources that we'll have available in the coming weeks.
Condolences to you on your dad.
Appreciate it.
Why do you think men, especially Black men, are scared to go to the doctors?
Yeah, I mean, I think we have valid reasons to be scared, right? I mean, This system has not. This system has disenfranchised our people. So I think there is rightful reasons to be fearful. But unfortunately, if you live in fear, there's bigger ramifications for you to not take action, right? Yeah. So those ramifications could be, like my father, a decline in health, and ultimately leading to an early death. And so the system has, like I said, disenfranchised us, has not taken care of us. So there's rightful reasons, but we have to think proactively. We have to forget those things that are behind and focus on what lies ahead so that we can change the narrative for our community, right? We have a shot, right? It's not when I go to graduations and I see a grandfather and a father and a mother, a white family walking together, and then you see the mother and the son, and it's like, where's the dad? Well, he passed away or something happened, right? Like, we have a chance to reverse some of these things by just taking little steps. And that's what gets me. You probably can hear it in my voice. I'm from the South Side of Chicago, so I don't get to be in this environment often. So I feel at liberty to just kind of let it out. But like I care about my brothers and sisters, and anything that we can do at Live Chair and our partnering barbershops and hair salons, I think feel the same. We're with it.
And I want to piggyback with Andrew as well. Many, like he said, many people are just afraid to know what possibly could be wrong with them, rather going to the doctor and actually trying to find out a remedy to, prolong their life, like he said. And the reason why I use that car insurance like phrase is because we pay, and for those with cars, we pay this in car insurance every month. And we cannot utilize it unless we get into an accident or something negative happens. Then we're on the phone calling. You can't get an oil change with your car insurance. You can't get your tires rotated with your car insurance. Now, when you apply for this health insurance and you're approved, utilize it. That's one thing you can do. Call your doctor. Call your therapist. Schedule an appointment every month if you want to. As soon as you feel like your body is changing, call. And that could possibly, they could figure out maybe something is developing they can get rid of before it becomes something maybe fatal, or just something that can actually just have a total effect on your respiratory system or anything. So what you want to do is utilize your services if you have them, whether it's free, whether you're paying $7 to $200, utilize. Go ahead and pay your whatever copay if you don't even have a copay. Call your doctor. These things, stay healthy, and make sure that you can take on your generations of family.
Hey, Dre,
Can I chime in?
Go ahead.
This is why what we're doing through the barbershops is so genius, because we're meeting Black men where they are. And Andrew talked about the whole trust factor. The barber, we know more things than a spouse knows. That's why it's so hard to find a good barber. It's that relationship. So we're like, the barbershop is the pillar of the Black community.
Yes, it is.
Coming in, if we know, what's going on, and we're pushing certain, things in terms of healthcare, and we're being educated, and we're bringing it towards the people, what is a better place to show it than the barbershop? It's genius what Live Chair is doing. And I'm just glad to be a part of it as the pioneer barbershop, Nile Style Barbershop.
Yeah. That's awesome.
Yeah, I was going to just chime in on what Damian said, right? Just to put this from an analogy perspective, right? Like, I'm pretty sure everyone watching or listening to this, they have, Wi-Fi, right, in their home, right? If you have Wi-Fi, just imagine using Wi-Fi or paying for Wi-Fi every single month and then not using it, right? Like that would be crazy. So if you have health care, right, or health insurance, utilize that health insurance, right? So that you can forever use your Wi-Fi, right? But like, just going back to the analogy, but I just want to make sure it connects in people's head. Like, you have it, use it, and if you don't know how to get access to it, that's where the partnership with the Maryland Health Connection and Live Chair Health comes in. We'll help you do that, because even when you go to one of our participating barbershops or hair salons, there's a check-in mechanism where if we intake your information, we'll have one of our health coaches follow up with you as well to get you connected with someone like Damian, or walk you through the estimate form as well. So the resources are there. The onus is on our people to step up, right?
Yeah.
Like, step up. Just like you get fresh to go to the club Friday night.
Well,
like,
not now. Not now.
But soon, right? We need to get freshed up. We need to tighten up and get on that computer and go to the American Health Connection. We need to have the same fervor and passion about our health like we do other extracurricular activities.
And go ahead.
No, that was it. I was just saying, if we get a high participation rate, whenever this COVID stuff is over, you'll see me at whoever wants to invite me out to the club. I don't even go there, but I'll go if people are engaged in their healthcare. Like, that's coming directly from the CEO's mouth.
Health insurance is very important. And it's interesting, Damian, that you brought up that car insurance analogy, because you don't really use your car insurance until you get in an accident. I mean, your car can get vandalized. Most people say, I'm not calling my insurance company because my premiums are going to go up.
Mm-hmm.
So healthcare is a lot different. You have to use your healthcare. Damian, how are you going to make this process easier for the people that may need this and may need to enroll by December 15th?
We're conveniently available via phone, and we give instructions on how to apply online. www.marylandhealthconnection.gov. Also, for all of our computer tech savvy individuals who just stay on their phone 75% of the time of the day, and iPhone will let you know how often you are on the phone. There's also an app you can download, Enroll MHC, and you can actually apply on your phone. We're just trying to make this as convenient and as accessible as possible. Since we cannot see you in person, we're bringing it to you. So what you do, you just log on, create your account, and if you feel unsure for the first time, go ahead and get your estimate. And once you feel confident that this insurance is actually affordable for you, go ahead and go to create your account. And at the end of the application, you can either call us or finish it yourself. If you're having any difficulties, please call 410-500-4710, and you'll speak to a navigator like me who will walk you through the rest of the process, break down every plan. And when I mean break down every plan, if you need us to go through every plan, we will go. We will give you, we'll ask you about your household size and what it is that you technically need for your household, and we will pick the perfect plan for you. And like it says, the one-stop shop. You can even shop for dental plans.
Because dental insurance is very expensive. The dental dental plan is included into this?
Certain plans, they do offer your routine dental care. Routine meaning your checkup and your cleaning. Now, we can offer additional plans for everything else. As far as Medicaid, which is the free state insurance, they cover a lot more when it comes to dental. And we will break that down, give you an MCO, which is a managed care organization chart, which will show the difference between every MCO and what they will cover and what they won't cover. And then if they do not cover that, we'll also push you in a direction where we will give you resources that will have you or just give you options to other dental plans, who will cover that. And the dental plans that we are offering are not that expensive.
Okay.
So it's all about just contacting us at MarylandHealthConnection.gov. And also 410, if you possibly you're not computer savvy, get on the phone and call us. And we do have interpreters as well. So if maybe somebody who's speaking Spanish, or we have interpreters. So we can.
Last question, and this is for the three of you. What do you find most confusing about health insurance? We'll start with Shanile.
I think one of the most things that's confusing about the whole health insurance is that most people don't know where to start. I mean, yes, you can go online, but it's so foreign to so many of us that you just don't know where to start. So I think that's one of the biggest boundaries. You know what I'm saying? One of those biggest things that keeps us from taking that second step of wondering where to start, because it's so uncommon in our community.
That's true, Shanile. And it's scary. I think a lot of people it's when it comes to healthcare and health insurance and health, period, people are afraid because of the lack of knowledge.
Right.
Andrew, live chair.
What's the question, Dre? I'm sorry.
What do you find most confusing about health insurance, healthcare?
Yeah, I mean, health insurance, I mean, just like, most like a deductible, right? Like what is a deductible, right? What is some of the terminology, I think, is pinned in corporate boardrooms, and they don't take in consideration the people that, may not have matriculated to that level of education, right? And I don't think it's just the education, like just for people that have attained this amount of education. I think a lot of folks, right? Like just there's a lot of verbiage and a lot of acronyms and like just jargon that the health insurance industry, I think, throws around that really confuses people. So I think one of the ways we can combat that is like putting it in, simple to understand phraseology and terms. I think that'll dispel a lot of the mist or the fog, right? And then as far as your second question, like what's wrong with healthcare? Well, we have to do another session for that. So, So let me know when you want me back on. Just a 24-hour break for that.
I thought I would just, throw in that healthcare question at the end. Spin off of that one.
Yeah, no, I'll say something real quick though. So okay. Healthcare. I think so. Healthcare in general. It's so political, right? And I'll just be honest, it's so political that the pendulum swings every 4 years or 8 years, right? Depending on who's in office, there's certain laws and regulations, and it's different states have certain ways of practicing healthcare. I think that's why Live Chair Health exists, because we're going to say, look, no matter who's in office, you know what I'm saying? No matter what's going on in this political arena, like we got your back, right? So one of the things that we're going to do is develop our mobile application where people can get this simple, digestible nuggets on we talked about mental health earlier, right? How do I practice 2 minutes or 3 minutes a day of mindfulness, right? So we'll have those type of things in the application, right? I'm experiencing this, what should I do about it? So our content, because we have a brain trust. So it's a African-American doctors across the U.S., from cardiothoracic surgeons to primary care physicians. Shout out to Dr. Noble. He's actually in the chat. And Dr. Nelson, Dr. Athel Morgan as well, local Baltimore cardiologist. So we have this team of doctors that's allowing us to take what they've learned over the last 15, 20 years in school and distill that down into understandable things where someone in the hood can say, all right, I can do that 2 minutes a day, or, oh man, that's what that means, right? I get it now. And so that's what Live Chair Health is doing, but that's my snippet on what's wrong with healthcare.
Okay, all right, so we got to wrap it up here in a minute. Damian, why do you think healthcare is so confusing to people? Real quick.
I'm gonna keep it brief, but I'm gonna piggyback off of Shanile and Mr. Suggs here. They hit it nail on though. Many of our clients, before coming into the office, they're like, before I even do the application, I can't afford it. I'm like, how do you know? You need to go through the process, and we can actually assist you. We're here to provide you financial assistance. We're not trying to sell you. So people think that we're salesmen. No, we're here to assist. So people come in and they really don't know that it's affordable. Yes, it is affordable. Okay, and then that's why we take down your demographics and your household, see what we can actually offer you the most affordable and most convenient plan possible. And then as far as Mr. Suggs, I would, like I said, like it's all about the simplicity of it. A lot of people don't know that it's as easy as calling one Healthcare Access Maryland and having this breakdown. What is an out-of-pocket max? People think that, oh, I have to pay this out-of-pocket max in order to just go to the doctors. No, that's not the case. Oh, people think that there's an annual deductible. I have to pay this annual deductible in order to go be seen for my COVID test. That is not the case. We break it down, we explain, and I know we're short on time, and I can go into annual deductibles and out-of-pocket max, and I'm pretty sure I can take up another 20 to 30 minutes.
Yeah.
Yes, just visit us on www.marylandhealthconnection.gov, and also 410-500-4710 is a very quick, convenient call, and we're here to answer any of the questions. And don't be afraid to ask any of those questions.
All right, so Damian, I gotta ask you this.
Okay.
Go. Suppose suppose someone out there doesn't reach that December 15th enrollment deadline. Where does that lead them?
Well, sad to say, if they are not eligible for Medicaid, right now at this time, they'll be ineligible until there is a what is called an SEP, was a special enrollment. We have different reasons to special enroll somebody out of the open enrollment. That's another 15-minute conversation, but it is very important. Do not delay. We have until the December the 15th to enroll in this health insurance. Now, Medicaid is, you can enroll 365 is all year round. This open enrollment is specifically for qualified health plans, for those who income is over the threshold for Medicaid. So I would not encourage people to wait to the last minute. I would encourage them to get on the computer right now, start the application, at least start it. And then if you're having difficulties, call Maryland Health Connection, Healthcare Access Maryland, 410-500-4710. I say that number so many times, but the more you say it, it sticks with people. So I really just encourage all my clients, all of the population out there, we have to keep on pushing and informing people that there is affordable healthcare out there. Do not wait till the last minute, because we don't want to accumulate those bills, and we want to save lives out here and also make sure that everybody's healthy.
Yes, indeed, especially during this pandemic. And the Maryland Health Connection is the state's health insurance marketplace. It's where you can find a health plan that fits your family's needs, your budget. And this has been a great conversation. Barbershop talk. Got a lot of pertinent information out. And I want to thank Damian, Shanile, and Andrew for actually sharing your knowledge today. And of course, December 15th is the deadline. The number again, if you need appointments or more information, is 410-500-47. What's the 447 right there? I didn't put the rest of the notes down, but we thank you for checking in. We have went way over our time because this conversation was so important and so pertinent for the community. And guys, thank you again, and thanks for tuning in.
Absolutely. Good work,
Yep.
brother.
Peace.